I'd like to call the Board of Health meeting to order at 5:39 PM. If everyone could please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, up first on our agenda is Thomas Ravane, concerns regarding well regulations. So I see that Mr. Ravane has not showed. I'll just back up. So he was notified 2 phone calls and an email?
Yes.
By you, and George, had you spoken with him? You were the one who advised him he could come in front of the board, correct?
Correct.
Okay. So, I know he had some concerns regarding the well regulations, but you're following everything that it should be. There's been no other issues. I looked through the well regs, I mean, so.
I'm just following the rules as they're written.
Perfect, that's all that's perfect. I know that you talked with Camille about it. We're behind you, well, I don't wanna speak for both of you, sorry. I'm behind you, 100%. So, where he didn't show, we're just gonna continue on and
Okay.
follow through just like we've been doing. Everybody else follows them, so we appreciate your time and everything that you're doing.
All right.
Thank you very much. I know, quick and easy, see?
Thank you.
Thank you.
Thank you, Joy.
Okay, number 2, body work regulations. So this is on here just as a kind of, I printed off 2 regulations because I wasn't sure if Camille was gonna be here, but she ended up being here. So do you wanna give them just a little quick overview as to why we're doing this?
Sure. So for the town of Dudley, we currently have one Body Works establishment, and I've been reached out to by another establishment who is proposing to come in to do Body Works. They do not fall under the massage therapy, which is overseen by the state, and we don't have any local regulations to have any jurisdiction over this practice. So I've spoken with Jen about it. Other communities in the area, some do have Body Works regulations. Pretty much it falls for anything that is not massage, but is still physical touch, acupressure. I'm drawing a blank on all the other examples of it. But there are other physical manipulations that fall under Body Works. There have historically, not necessarily in Dudley and or in neighboring communities, but Body Works establishments, there's benefit from public health standpoint for having regulations, as they can sometimes have inappropriate behavior going on, and this gives a local board of health the jurisdiction to go in and close them down if, heaven forbid, anything like that was happening. Without those regulations, we don't have any jurisdiction to issue a permit and therefore suspend or revoke a permit.
So looking quick, Camille had told me about Framingham. She was familiar with the Framingham ones. And then I just looked around to see another town similar to us, and I found town of Oxford has them. So basically, homework is read them over, look at them, if you find any others or something else. And this is something that we're going to be working on for the next several months to try to come up with something. And just like we did with the nail regulations, if they're currently active, they'll have a year to fall into compliance or something to that effect, like we did in the past.
Good. Okay.
Sound good? Any questions on that?
No, I think it's a great thing to do. We talked about it in the past, and
Yep.
COVID happened, so we got a little distracted, but I think it's a great time to address this situation.
Perfect. So we will be going forward with that. Okay, number 3, Earth Day, discussion and planning. So, Amanda applied for the grant through the Last Green Valley. She did, I did nothing. She ordered a bunch of supplies. And we need to choose a date for Earth Day. The official Earth Day date this year is April 22nd, which is on a Saturday. So, does everyone want to check their schedules? Because what I will have to do is put a request into the Board of Selectmen, talk to Jeff.
I don't have anything. April 22nd?
Yes. And
And the typical 8 to 12?
8 to 12.
In the highway department?
Yes, just like always, I'll reach out to Jeff, make sure that we're good. He'll get a dumpster. I'll get permission from the Board of Selectmen. And if you,
Contest again?
yep, we do drawings. Amanda, if you can reach out to the school, if you talk to Michelle for the honor societies, see if the Girl Scouts, can you reach out to Boy Scouts?
Yeah.
And Cub Scouts, we'll talk to Nicole.
Oh, sure.
Because I know she had mentioned, try to get more people involved. And we will need someone for Dudley the dog.
Oh, got somebody in mind, huh?
Okay. So we'll work on that, and I'll send a letter to the Board of Selectmen, just so that we can get it. And as soon as I get permission, I'll send information to Amanda to get it out on all,
Social media?
yep,
Nice.
and
Okay.
get it
Sounds
going.
good.
Sounds good? So, April 22nd from 8 to 12, and we will go from there, and we'll follow up next month to see where we're at.
All right.
Sound good?
Mm-hmm.
Any questions?
Nope.
Perfect. Next up, bike rodeo. I have nothing. Do you have
Mm-mm.
we have the date, we have a few things confirmed.
What's the date? Let's talk about the date again.
The
Oh, I
date
forgot.
is June, Thursday, is it the 22nd?
Okay.
We have permission already to be at the Dudley Grange the week before at the Strawberry Festival with information about the bike rodeo, so we can set up a table. That's usually from 4 to 7-ish, or till the strawberry's gone. So we can set up to remind people about it. Do we have a flyer for it?
That's always a Thursday, Jen?
Yes.
The strawberry thing?
Yeah, it's the week before.
Okay.
Do we have a flyer for the new bike rodeo?
I think so. Didn't I send it back to you? Because we changed the dates? I thought so.
It wasn't a flyer, we just did the cards. We can make a flyer.
So we
Oh,
need a
okay.
flyer, and
Yeah.
to include on it anything with wheels. Be it scooter, skateboard, rollerblades, roller skates,
Yeah.
anything, they can come.
Get the share hoverboards?
Yeah. You know, and even if they don't want to ride their bike and they just want to come and learn about it, so if we can get something together, and then we'll get it over to Amanda so she can
Okay. I think I have.
keep
I'll work
putting
on
it
that.
out. Yeah, that would be great. We decided we didn't want the firehouse, cause the safe house, cause it's gonna be at the
Strawberry Festival.
week
Yeah.
before. So I guess we can start reaching out to groups to see if they wanna come,
Mhm.
like the PTO, Boy Scouts, Cub Scouts, Girl Scouts, the Boys and Girls Club,
Mhm.
just a few off the top of my head. To see if they would be interested, they could set up a table, have literature, handouts, fun things, whatever. And then we'll start working on food in the next couple.
Can we share that amongst, say, Oxford, Charlton, Southbridge Board of Health somehow, like to let them know what we're doing? I mean, some towns, I know Charlton does something already,
I don't
sort of,
know,
but
yeah, I don't know of any other towns that are doing like a bike rodeo off the top. I
It
haven't
doesn't
seen-
hurt, right?
No.
Either that or on their town forum pages,
Yep.
like Southbridge has it in Charlton.
Absolutely, because it's open to anyone,
Anybody.
you know,
And with the helmets provided by the Children's Hospital, that's a
Right.
huge bonus.
and be sure that that's on the
Yeah.
flyer.
Open to anyone.
Yep, and that Boston Children's Hospital will be there with helmets,
Helmet fitting.
and that it's the police, with the association, in association with the Dudley Police. So we'll work on that in the next month.
Dates with them now, so they'll plan
Yep.
accordingly.
Yes,
And I
so
think
if
Morgan came.
we work on that, and then we'll follow up again next month, and I'll start working on food and stuff.
Okay.
Perfect.
Are we gonna reach out to Nichols again? We're gonna have it here this time.
Right, and it'll be, school will be out, college will be out
That's correct, yeah.
in
Gone by
June,
then.
so probably not a lot of, that they can do for us,
Mhm.
but we can all, once we get a little more planned, we can let them know about it.
Right.
And they can promote it, you know, if they choose it, that's something else, the radio station.
Oh,
Nichols
the one that-
Radio, yeah, Nichols Radio Station.
That's true.
A lot of people comment that they listen to the radio station and that we've done our clinics in the past on there, and that's how they found out information. So just as a, okay, all right. So up next, public health nurse report comments.
I don't really have any. To tell you the truth. I don't follow the Maven, cases anymore, so.
Okay,
We actually have Sarah Caplet here, who is our regional public health nurse, who has also been assisting. So if Sarah, if this is the right time to
yeah, she
have
can
her
come up,
introduce.
just introduce yourself if you wanna tell us a little bit about yourself.
Sure. So I'm Sarah Caplet. Hi, I'm the regional public health nurse, and I cover Oxford, Dudley, Southbridge, Webster. I've been, along with the epidemiologist that I work with, Brianna, we've been covering Maven for Dudley. It's been mostly a lot of flu lately. COVID's still pretty high. Other than that, it hasn't been too bad. Dudley's a pretty good town, considering. And the only thing I can think of that was kind of like, might be something that we might want to do something with is, I've seen a prevalence in older adults getting chickenpox, and I'm not talking about, what is it? Shingles, actual chickenpox. So it just might be something that maybe in the future we want to maybe just send something out or just make note on maybe a social media page about, because a lot of older adults never got the vaccine since it came out in the 90s, and most people would go to chickenpox parties, and if you didn't get it as a kid, then it's a lot worse when you're an adult. So that's the only thing I've been seeing, is just more varicella kind of hanging out. Other than that is flu and COVID, and Dudley's actually doing pretty well with those numbers comparatively.
That's good.
That's good.
So are these older adults who've never had chickenpox, or they're getting them again, or?
It's very likely that they may have had it as a child or just have never had it and are getting it again. A lot of people don't maintain what is it called? Like antibodies for it. So some people, they do actually suggest, for now the CDC is coming out saying that either teenagers or young adults should get another booster shot of varicella, just because it doesn't usually hang out too long in the body. Sometimes it does, sometimes it doesn't. Some people are also exposed through their own children, never really realizing it because they have vaccines, so that helps booster their immunity to it. So the older adults, because they're usually either immunocompromised or just more susceptible, it's been maybe 60 years since they've had chickenpox. It's just one of those things, I think, that happens sometimes. But most of the chickenpox I'm seeing is with older adults right now.
And same symptoms?
Yep.
The sores?
It's
and
just usually more severe in adults because their bodies aren't equipped to handle it. So a lot of people might even end up being hospitalized because of it.
can you send some information over to Amanda via email, and then
Absolutely.
we can work to get it on the webpage and all over?
I was even on the CDC, because I had a case today, I was even on the CDC earlier. They have a bunch of infographics maybe that I was thinking that we could either just post on like a
Yeah.
Facebook page or anything like that, just reminding adults they can still get chicken pox.
That
It
would
can
be
still
great.
happen.
And get it down into the senior center to Deb?
Yep, yeah, yeah, if Amanda will get it, and then Amanda will get it to Amanda, and then we'll get it all over. That would be great.
Yeah, absolutely. I have
Thank you.
a
That's
bunch of
interesting.
infographics that are colorful and helpful and people, eye-catching, so people
Yep.
might like those.
Absolutely. Any other questions? Great.
So one thing, Sarah and I yesterday were on the Vaccine Equity Initiative conference call through the state. Dudley has been identified previously as one of the communities with low vaccine rates for COVID-19 and or higher, I forget what the criteria was.
It's like demographic essentially, though. It's
Demographic with low vaccine rates.
exactly. So
Um,
Dudley is kind of in that it's a small town, and the demographic is kind of further away from the major cities, so it tends to need more. Kind of.
So one thing that the state was kind of asking, the call yesterday was talking also about Webster and Southbridge and different community partners within those three communities. And we didn't really have any good contacts or feedback for Dudley representation in that call. So I didn't know if the Dudley Library has a lot of activities and or if there's a point of contact over there that might be interested in hosting a COVID vaccine clinic. Any vaccine clinic that is offered through the state through this initiative, every person receiving the COVID-19 vaccine does receive a $75 gift card. And they're also able to combine it with a flu vaccine clinic. So getting your flu shot does not qualify you for the gift card, but any COVID vaccine would qualify for a $75 gift card. So we're just trying to think outside the box for other.
Yeah, I would say, I would give Drusilla's contact information. She's the head librarian.
Okay.
Yeah.
Are there other agencies in town?
Did you call the Boys and Girls Club?
I don't.
They had
know.
called me.
Okay. I was unaware that they called you, so I can.
Liz Hamilton had reached out to me because
Okay.
somebody must have given the group their number or their name.
Their contact, okay.
And then she called me to see, what are you doing? Are you doing it with us? And I said, I'm not. It's got nothing to do with the town. It's more the initiative. And she said, oh, okay, thank you. And I left it at that. So.
Do you think she was interested in offering a clinic, or?
This was before it was supposed to be over in December.
Okay.
So it was probably, I want to say it was like before Thanksgiving.
Okay.
Maybe like a week before Thanksgiving.
Sure.
So
So
and I
it's-
said, I'm not really sure, so I didn't really get into detail with her because I really haven't been a part of it and I didn't really know. So I said, if they reached out to you, that means that the public health regional nurse gave them your number. That's kind of what I thought because I know I hadn't. So,
Sure. Okay.
You might want to reach out to Liz Hamilton and see
Okay.
if
We can make that connection again.
because they have a lot of kids there that that are from Webster, from Dudley, from Southbridge. There's a lot of kids that go there.
And it seems like, at least in Southbridge, they have a couple clinics planned for right before February break. So the existing initiative has been extended through March 31st. So they could have, multiple clinics. If it's first-time doses, you can get $75 for your first dose. Come back a month later, get $75 again. It includes for minors as well.
So you had reached out to Tri-Valley, correct?
I know that there was talk, and Connor mentioned that we were going to talk with Tri-Valley.
With Tri-Valley, yes.
Because I thought
Don't
there was
know
a
if we
clinic there.
did, but I know that it was brought up.
There was a clinic there back in December.
I thought there was
December
a clinic
resource
there.
fair.
Yes, at the resource fair.
And it did fairly well.
Okay. So that would be, I'm trying to think of any place else.
The only other thing that I can really think of is Gentex up the street.
Okay.
Because Kelly, stayed in touch with me throughout the whole pandemic. I even gave them some COVID testing kits because they still test their employees.
Sure.
So in conversation, I was like, well, that's what the Board of Health is for. We have them. Please take some. So I shared her our information for our first, not our very first state-run clinic, but when we did it on our own, they sent a ton of people over.
Yeah.
Okay.
So you might wanna reach out to her. Like I said, they're still testing their employees.
Okay.
And they have 2 shifts. They have a day shift and a night shift, so
Okay.
you might find some of those people are available.
Sure, if
later
you
in
can
the
get
day.
us their contact
I'll send it
information,
to
we're
you.
happy to share that along with the state. The one caveat I will say is that the gift card initiative is only for Massachusetts residents. So I know we're a border community, we
yes.
might have some Connecticut folks that work there. They might not be, they can get the vaccine, they just wouldn't
Still
be
get the
eligible for
card.
the gift card.
All right, yeah, I'll send it to you.
Yeah, okay. So we'll have Boys and Girls Club, Gentex, and then the library
Library.
contact.
Yeah.
Awesome.
Yes.
They're fairly big, even if you got 50 people.
Gentex is, yeah.
They've had clinics as few as 14 and have been excited about it. So I know Webster's had a handful. We had one clinic that was like 100 people got vaccinated. A second one was 50 or so. And they were
reached out to
very
Josh.
pleased with those turnouts.
Did, yeah, she said no.
That's what I thought, okay.
Yeah.
So, yeah, that's all I can really think of. Yeah. Okay, great, thank
Awesome.
you.
You're welcome. Thank you.
Thank you, nice to meet you.
Nice to meet you.
Okay, up next, excuse me, health agent report comments.
I have a few different things. While we're still kind of somewhat on COVID, I will provide an update on the iHealth COVID antigen tests that were distributed through the town of Dudley. We had received our supply back in February of 2022. The date printed on the back of the box read July. It had been extended multiple times. Those are currently valid through April 23rd, 2023. So they've been extended an additional 3 months from the last time that they were posted. Were you guys using the QR code stickers on the front? Okay. The issue with the QR code stickers right now is that the QR code brings you to the manufacturer's website, which is not up to date with the current vaccine, with the current expiration dates. If you plug in the lot number on the manufacturer's website, those test kits are going to say that they expired yesterday.
Okay,
I confirmed with the state and the manufacturer themselves, they have been extended through April. The FDA came out with this update on January 11th, and the manufacturer on the back end is working on filling in all of their lot numbers with the appropriate extended expiration dates. So manufacturer's website is not correct right now, which is frustrating because that's where local boards of health and the state has been directing everyone to check whether it's in date or not, but they have been extended through April. Yes.
do we have, only because I'm sure we'll get a few people, any documentation stating
I can
that?
provide that. Yes, there is a, if you even just Google search the FDA, if you Google the iHealth and then that lot number on the back of the box, it will pull you up to the FDA's updated
Okay.
January 11th list.
Just because I'm sure some people are gonna want.
100%. Yep.
Are gonna want something,
Yep.
you know?
Yeah, we gave a lot away at the salon, but I did tell them that
Yeah.
it was extended beyond what the January date on the
Yes.
box said, so.
Okay, perfect, okay.
And that applies for all COVID tests. So if you have tests that are, I know Webster just got another supply that on the printed, it says it's good through March. Those are now good through September. So it's just keeps making everyone's life confusing.
Have boxes.
Oh, yeah.
Okay.
Okay. Next on my report, I wanted to introduce Eileen Alexander. She is our public health coordinator through the South Central Mass Partnership for Public Health
Okay.
region, which is our regional grant. Eileen, do you want to come up?
Come on up, have a seat, introduce yourself.
I'm Eileen Alexander. I work with, I think I work with a few different towns than Sarah does. 7 towns. It's Auburn, Oxford, Webster, Dudley, Southbridge, and Brimfield. So 6?
Yep.
One of our biggest events that we're going to do over the next year, or that I've already started, is a community health assessment amongst all of the towns to see what our highest priority is for each town, what the health inequities might be, and what we should be focusing on for healthy environments. I work for the town of Webster is the host, and I also do like higher end housing for heavy content, hoarding, and try to find resources for our most vulnerable people in all of the communities. It's been a challenge with 6 communities to try to put together something to focus on a community health assessment that meets the varying communities. We have a couple towns that are more like cities, a couple towns that are rural, one that's very rural, and everyone has different needs. So currently, right now, I've completed the structure of the health assessment, and now I'm doing the demographics of all the towns. So I will be, I've met with Tri-Valley, that's one of your highest stakeholders, but I will be starting to work with a list for Dudley for the stakeholders, community representation, people that, you know, would be part of our group to help, like a steering committee, if you will, to help determine what direction the health assessment will go in, probably like a community survey, and then take that data back and, you know, prepare what we think the highest needs are.
So I would hope that you'll be in touch with our Council on Aging Director,
Absolutely.
because that, for us, has been one of the areas that we feel
We need the most help, I
he
think.
falls short a lot. There's definitely the hoarding situations and everything as well, but that is, I think for us, it was a little more attainable to work with the older population than for us dealing with any hoarding situations or
Yeah.
anything, you know. So
A lot of the older population, quite honestly, are the ones with the,
Yeah.
I know they call it heavy content now, but it also, and it stems around, you know, a lot of inconsistencies in their health. And so they're, you know, gradually, but now they're there, and they have health problems on top of it, and it's hard to get out of, but definitely, they are on the top of the list.
that's good.
Police and fire are on the top of the list because they're really out in your communities. They're, you know, picking up if you have an ambulance system, bringing the sick ones in. They're out on site and can see a lot more than we know is going on.
I will say our police and fire are very good about notifying us with anything.
Yeah.
The slightest thing, they're very good about notifying us. We're very fortunate, I think, because we have a good, but they definitely would want them involved.
Yeah,
Because they're our eyes and ears,
absolutely.
so.
And they bring all the different parts of the stakeholders that you get involved. There's a commitment on our part, but there's a huge commitment on their part, so some want to, some don't. Our municipal people will be our best allies.
Oh, yeah.
But then there's gonna be outside community. I've already met with Tri-Valley. They're on board for many different levels. They've offered up, you know, when we get going, because they can offer to us what services they're already given. Quite honestly, I was surprised at some of the services that they already have on board, but maybe need help reaching the people. And then we have municipal people that reach the people but maybe don't know. So, you know, kind of a coming together. The stakeholders that you choose for your town to be part of it and that agree to be part of it are really key, because they're the ones that steer it. And then when the data comes back, I can do as much as I can with the data and put it into all kinds of modules and say, hey, here's your top 3. But without getting the proper data, it's you know, what you put in is what comes out.
Right.
And so, you know, we're trying to be heavy on the top end of making sure that when we get to the point that we're gonna go out and start doing surveys, that everyone's on board saying this, we're not asking questions for answers we don't want. You know, you don't wanna steer people in a direction so that the questions are all geared to something else. You want it to be free-flowing. I did write down your 2 dates because some of the ways to get this out, once we get groups and we have questions we want to know, will be that I will be part of going to a lot of your events.
Absolutely.
So I wrote down the Strawberry Festival, because I heard you say
Yes.
it, but I wrote down the bike rodeo, the Earth Day, because that's how I'll get out and meet the community and be able to ask the questions. the people in the town know, when I start reaching out like to the senior center, I'll actually be going there and, you know, and asking for a meeting and asking, you know, what they're successful with, what they feel they need more help with, and what they feel their overall residents that visit with them are in need of.
Well, that's great. We've, over the past year, I would say, we've been putting ourselves out there much more, going to different events to publicize. We gave out information, well, at trunk or we attended a trunk or treat,
Oh, yeah.
and it was to give information about our bike rodeo, save the date card, but also we gave a free COVID test kit and information on the flu, and just to, we did that, we did the Apple Fest, just to try to get out in the community to give out information.
Yeah,
Spectacular.
I think you surprise a lot of the community when they say the Board of Health does what?
Yeah.
Yeah, I think that you surprise a lot of people, so when you go out, that they know that, yeah.
So, that's great, we
Yeah.
appreciate that. Excellent, thank you.
Looking forward to hearing more and seeing things happen in the future.
Absolutely.
Yeah, everything I coordinate will be through Camille, so we'll start setting up, and then, you know, she can discuss with you who I think are good stakeholders, and you can add, subtract, you know. Like I said, we could reach out to 15 people to come to the table, and, you know, so we can all hash what we think is a good move, and only 8 of them may have the time
Right.
to even help facilitate. And that's great, because up front, we wanna know that. There are a couple other community, groups that are doing community assessments in certain areas around here. And, Open Sky was one of them for Southbridge and, Webster. And I'm going to meet with them. I just had some contact with them, because they're already doing some of it. And if some of what they're already doing in them communities makes sense, that it works for our community, we don't wanna be doing the same thing. We wanna jump on and say, here, you have mine, I'll have yours.
Right.
Because all that does is shorten the timeline. Because at the end of it, we can identify 3 to 5 things for every community, but if we're not gonna do anything with it, why did we identify it? So the other part is taking the data that we get and trying to find ways to, if it's an improvement that we're looking for, if it's an education that we're looking for, if it's a program that requires money that we're looking for, we need to be able to have on the back end what we would do. So, you know, if homelessness shows up, if that is your top one, we already wanna know some of the things that we can do for that. So if they've already, there's a lot of nonprofits out there that are already doing it, that we can team up with, that will hopefully shorten the
We
timeline.
do have a local, the Blessed
Yes.
Backpack Brigade.
Yeah.
What's it called?
The Blessed Black Backpack Brigade.
Okay.
So that is,
Yeah.
Lori Joseph and KJ, their daughter, KJ, they are very involved locally, Webster, Dudley, with, feeding and clothing our local homeless. Once a month, they have a meal that they can come to just over the railroad tracks on the Webster Dudley line on Davis Street, once a month on a Sunday. They usually have a local restaurant that will donate food. They put meals out. They can come, they're very active, so they would be a good resource to connect.
Yeah, that would be great.
Yeah.
You think if I Googled them, I'd get
Oh, yeah, they're on
contact?
Facebook and,
Okay.
yes.
Absolutely. Yeah.
Yeah.
There's a couple other two that I
Because I've Googled a lot about it, and so without you saying that name, it probably wasn't coming up in the type of searches I'm doing,
Right.
so that's why I see the need that once I talk to different people and different faces in
Oh,
different
yeah.
areas, all of a sudden, you hear something new that I didn't hear before.
Right, yep, in Webster, there's the United Church of Christ that does the soup kitchen.
The Boy
twice
Scouts
a
and
month.
Dudley help out, so.
And they help out now.
Oh, yeah.
I have all of, because I make a list of all the faith groups. So for every town, I made a list of all the faith groups. That doesn't mean they'll all come to the table, but it means that then I can start contacting and say, do you have any outreach programs? You know, where are you at with your outreach programs, and start just collecting the data. So a lot of data is collected up front before you even get to the table. You have a lot of ideas already with the major stakeholders, of, you know, of what you want to put on your survey. Once the survey's out and the data comes in, the data's the data. So it's the questions that you decide to ask and the way you word them that matter. Because that's, when the data comes back in, that's how it's going to be separated and calculated and determined, and it's graded. You know, there can be a 1 to 10 grade, and then you take 5, and, but once the data's there, that's a public document. And,
That's great.
and that's where you try to move forward for them improvements.
That's great. That's wonderful, because it's not something that we would ever get to with.
I think that was the purpose of this,
Yeah.
and I can tell you, you never get to it. I'm like, every time I stop, get in my tracks, and say, oh my God, did I not consider that? You know, because it's 6 towns.
No, and I think it's great, I mean, because we have such limited resources with our agent, and there's no way.
There's
so
so
this
many
is
great
wonderful.
programs out there. One thing I've already learned is there's just so many great programs out there that are helping people. So, you know, if we can pull anything together, and if we can look for any type of grants or, you know, public health monies that can address it, then that's our hopeful outcome. That we identify something and we have an improvement track that we can evaluate, you know, after the year or the year and a half that it's in process, that we can evaluate that what we did improved something.
Great.
Phenomenal. Thank you, that's awesome.
Thank you very much.
You're welcome.
Very much looking forward to working with it.
Lastly, for my agent report, we are moving forward with getting a consulting firm in town to do our food inspections. This is probably going to be a one-time, get everybody caught up. There will be re-inspections as needed for any food establishments that need it. But we're in the process of finalizing the agreement with Alsco Food, and Alfred, I'm probably not gonna say his last name correctly. He's retired. He used to work for the Department of Public Health's Food Protection Program. He's been a health agent. He runs this consulting firm now. He has multiple food inspectors. We're likely gonna have 3 listed, 1 primary that will be helping out in town, and it will probably be a month and a half to 2 months to get both Webster and Dudley fully caught up. So I will be providing them an introduction letter for all of our establishments, so that way, because they're not going to have any sort of identification, so we'll be notifying all of our food establishments. We are working with this consulting firm. These are the names of the individuals that may be coming into your establishment to conduct food inspections. Obviously, if any restaurant or establishment has questions, they can reach out to the Board of Health. Then I will also be providing the consulting firm a list of all of our establishments, and we'll start going from there. So I'm very excited to get that moving along.
Great.
Yes. And I think that's everything I have for my update.
Great, thank you very much. Any questions for Camille? Nope, great, thank you. All right, item number 7, approval of the minutes for the December 5th, 2022 meeting.
I think that's the one I wasn't in person, was it?
No, you were on the phone. So
You
I
can
make a
still-
motion to accept the minutes from the December 5th, 2022 meeting.
I have a motion and a second. Any discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Now, next, the approval of the Board of Health meeting schedule for the 2023 year. So, take a look through and see if you have any conflicts that you know of. We have an issue with the February. Yes?
I do, yes, I just don't know the date.
So you have an issue with the February meeting, and there's an issue with the August meeting.
All right, so we'll go with the February 21st is not good for Roberta. I mean, I'm available Thursday night
Can we push it to the week after, or no?
or
that give us enough time if we do it in March, on
Yep.
March 21st?
Yeah,
I'm available the 28th.
27? Oh, I'm in 2024, excuse me.
Where you
Oh,
going?
hello.
I'm a-
Don't rush time.
No, sorry. 28th?
Yeah.
28th?
28th, I'm good with the 28th. So
28th.
Changing the 21st to the 28th at 5:30.
Yes.
All right.
And that was February?
Yes.
Correct.
Okay.
I'm okay with everything else.
Others looked 5:30. And who had a problem with the August one?
I have a problem with the August one.
So-
Could we do, oops, I just. Could we do the 22nd, the following week?
Right now, that's clear on my end.
Thank you.
So instead of the 15th, we're doing the 22nd.
Yes, thank you. So the rest look good.
Yep. So I make a motion to accept the minutes of the 2023 meeting dates.
I
Accept
second
the
that.
meeting dates for 2023.
Perfect.
For the Board of Health.
I have a motion and a second. No further discussion? All in favor?
Aye.
Aye. Passes unanimously. Thank you. Okay. Up next, any other additional public comments? You guys are good? Thank you. Any board member comments? Lori?
Not at this time.
Okay.
I don't think.
Ro?
No.
No?
Mm-mm.
Okay, so I have,
You?
yeah, I have some announcements, just to, I wanted to on, what was the date, the 19th?
9?
What
It was the 9th.
The 9th, Monday, oh yeah, Monday, on Monday, January 9th, the Board of Selectmen had a evening of, where the state gave out citations and the town gave out citations for work during COVID. So, from the Massachusetts State Senate, the Board of Health received an official citation we were given for our work during COVID. Then, the House of Representatives and, Peter Durant was here, as well as Senator Fatman. They presented again to the Board of Health. So we received these from the state for the work during COVID that we did. The Board of Health members each received, which I don't have, I apologize, a citation from the town of Dudley for all of our work. And Roberta received the Community Service Award for the public health nurse during COVID. We had a public health nurse that was covering 13 towns. We didn't feel that that was a good fit for during COVID, so Ro stepped up and was kind of thrown into public health nurse, and she did a great job during COVID. We appreciate the state for thanking us. We appreciate the town for thanking us. Never in my entire life did I think getting volunteering on a board would mean spending 24 hours a day, 7 days a week talking about COVID. Never, ever. It was a wonderful time. It was a trying experience, but we got through it. We had a lot of great support from the police, the fire. We had some change of health agents. We were without a health agent for a while. It was a very trying time, but I think we really did a great job, and I appreciate the state and the town recognizing us, even though none of us really wanted the recognition. You can, if you watch the meeting, we're all kind of like, you have our, you know, we just.
I was
it-
like, you guys rocked it.
This is what we signed up for, whether we knew it or not. And I will say that I'm glad it's behind us for the most part. And
Yeah, the peak of it is gone.
yes,
Right?
yes,
You know?
yes, yes.
Did we flatten the curve?
But I do appreciate, and they pointed out the other departments that were here, that,
Yeah.
Other people were covering multiple departments and everything during it, because we had furloughs, so I do appreciate the town for taking the time and we couldn't have done it without a great leadership. And we had a good, even though he did not want to be recognized, our town administrator kept everything going, but I appreciate everyone that we worked with during this, and I thank you. So.
Thank you.
You're welcome.
So, anything else? That was my,
Nope.
okay. Nothing else, I'll entertain a motion.
I'll make a motion to adjourn.
I second.
I have a motion and a second. Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously, closed at 6:24 PM.